Hi, I'm Professor Phil Batterham. I'm based at the Australian National University in Canberra, and I'm the co-head of the Centre for Mental Health Research. I'm conducting a range of different research in suicide prevention. My current study is the LifeTrack study, which is following about 900 Australian adults who have reported suicidal ideation. We're following them up over 3 years with surveys every 6 months. And we're finding that it's really quite difficult to understand trajectories of suicidal thoughts and behaviours. I think the take home message is it's not useful or helpful to try and predict who's going to have a suicide attempt. It's also important to think about what factors might lead people towards recovery and to always keep in mind that most people who experience suicidal ideation do not eventually have a suicide attempt as
My
well.
name is Alex Potter. I am a PhD candidate with the Manna Institute and studying through the University of New England. I am recording this today from beautiful sunny Newcastle, the land of the Awabakal people, where I am incredibly fortunate to get to live, work and study. I'm really passionate about this year's World Suicide Prevention Day theme of changing the narrative around suicide prevention. I think it's incredibly important that we raise a whole bunch of different narratives in relation to suicide prevention up and really recognise the diversity of lived experience, the work that's been done in lived experience spaces within suicide prevention, and also how we can further incorporate lived experience into all stages and spaces around suicide prevention. My research is looking at a different narrative, and the narrative which is around those people who are working in mental health professional roles and have a lived experience of suicide, but they're not in designated lived experience roles. So looking at people who might be working as psychologists, social workers, nurses, psychiatrists, and anyone who has those lived experiences, whether they've actually disclosed that or not in the workplace. And I think it's really important to be capturing those narratives and looking at how these types of lived experiences can work alongside people who are in those designated lived experiences roles. So I think World Suicide Prevention Day is a great day to be changing that narrative, to be sharing more narratives, and I'm excited to be hearing more from everybody who's working so hard in this sector.
Hi, I'm Hazel Dalton. I'm a Senior Research Fellow at the Rural Health Research Institute at Charles Sturt University. I'm also a Senior Researcher with the Manna Institute and chair the Rural Behavioural Health Collaborative for the Global Leadership Exchange, which connects rural mental health leaders worldwide. On World Suicide Prevention Day, I want to share how we're changing the narrative around suicide in rural Australia. Suicide rates in rural Australia are around 50% higher than in major cities. This is both inequitable and unacceptable. We also know that rural communities hold deep strength, resilience, and local wisdom. Changing the narratives means recognising suicide prevention as a spectrum that encompasses both the promotion of health and well-being of individuals and communities, right through to post-mention support. Some of my research focuses on collaborative, place-based approaches to community well-being, figuring out what works where and why. These initiatives are led by communities and address local priorities, structural, cultural and economic factors. Through local and global partnerships, we're sharing lessons, amplifying what works and advocating for change. This World Suicide Prevention Day, let's honour rural communities by leveraging their strengths, building hope, connection and meaningful change. Thank you.
I'm Laura Grattage, Associate Lecturer in Rural Health at the University of Tasmania, as well as an early career researcher and lived experience rep at Manna Institute. This World Suicide Prevention Day, as somebody with a lived experience who is now a suicide prevention researcher, I've got one word to say to you: together. Together, we need to stop leaving young people behind. Together, we can make mental health conversations safe and normal, not shameful. Together, we can ensure that genuine lived experience leadership, not token voices, but real leadership that shapes decisions from the start. And that's what my work is about. I've just finished my PhD, developing best practice guidelines for rural youth suicide prevention. I'm evaluating the Live for Life model being implemented in Break of Day, which is the first Tassie community to bring the community model to life. I'm co-developing a community-based suicide prevention evaluation framework to help communities find out what is working well. And I'm pushing to make sure lived experience leadership is built into governments and universities across all levels, so people who have walked the walk can make the decisions that concern them. Here's my call to action. Back young people, back grassroots community level efforts, and listen to lived experience. And that's how we can change the story together.
My name is Bess Jackson. I'm a PhD student at the University of New England. I'm super privileged to be receiving a PhD scholarship from Standby Support After Suicide. So my project is working along Standby, looking at ways that we can capture meaningful data about the program that is done in a really sensitive and appropriate way in the bereavement context. And I think my research is challenging the narrative that outcome measures or data collections are inherently harmful or of no advantage to the person receiving support. What I'm hearing throughout my research is that it really is the way that it's approached. If outcome measures and data collection are approached in a way that's compassionate and sensitive, there's actually a lot of value that we can get from it that can actually inform someone's support. So my call to action for this World Suicide Prevention Day is, if you are a service provider or perhaps a program manager or a service commissioner working in the suicide prevention sector, I really challenge you to have a think about how we can use data in a way that's meaningful and what narratives we can derive from that to piece together and tell a story about the impact of the amazing work that people are doing day in, day out in the suicide prevention sector.
Hi everyone, my name's Sarah Wayland. I'm a Professor of Social Work at CQ University and a Senior Researcher at Manna Institute. I've been working in suicide, mental health and trauma for a really long time, over 20 years. And I think that each time that World Suicide Prevention Day comes up, we exist between that space of not wanting to have to do further research in the hope that there might have been some capacity to disrupt or at least reduce the impact of suicide in our community. This year's focus is on changing the narrative. And for me, when I think about what that might do in terms of my teaching, in terms of my research, in terms of the ways that I connect with the community, is really making sure that we take time for calm and compassionate conversations. Not everybody knows or wants to know how to safely talk about suicide, with our family members, in our workplaces, with other people in the community. But changing the narrative is really about considering internally how we can shift our perceptions and reach out for information to better inform us about who is at risk of suicide in our community and how we can generate really meaningful connections and conversations with people on any day of their life. So this year I'm hoping that we change the narrative internally. Thanks.
Hi there. I'm Professor Mafamwi Maple. I'm Director of Manna Institute based at the University of New England. This World Suicide Prevention Day, the changing the narrative theme couldn't be more important. Suicide prevention is still dominated by a crisis-oriented paradigm, emphasising acute service responses and clinical interventions at the point of imminent risk. While these services and focuses are really necessary, it's insufficient to reduce suicide at a population level. I truly believe that prevention must be reframed to be conceptualised as an upstream, community-embedded endeavour that prioritises early intervention, social connection, and environments that are conducive to wellbeing, particularly in rural and remote areas. Second, suicide has often been constructed as an individualised phenomenon, a problem within the person. And yet we know that suicide is also so much more. It's about the social determinants and the influence these have on the structural inequities, the geographic location and isolation, experiences of stigma, both on risk and protective factors. So we must, like the new suicide prevention strategy in Australia highlights, look at the social determinants of health much more broadly, and as an outcome of that, see suicide reduced and distress reduced across our community. So on World Suicide Prevention Day 2025, I believe that shifting the narrative has to happen in two ways, from crisis response at the to a population level prevention, and from individual risk to collective responsibility.